Welcome to this webinar, the intersectoral action needed for the future health of people and planet. I'm Göran Tomson from Karolinska Institutet, Sweden, and SITE, and also a fellow of George Institute. I will be the chair of the webinar, try to facilitate and also be a timekeeper. Now, we are very happy to have a global group of participants, and we will try to make this as interactive as possible. Please use the Q&A functions. You can also use Twitter, and we will try to accommodate your questions as best we can. Now, if we will not be able to use your questions, rest assured that they will be used in the report that will follow this webinar. Now, we will also have two polls, and Anna will probably introduce them. We would like to know who you are, and I see that people are joining as we go, and still there are less than the registered numbers, but why don't we start with those that have joined? Kindly fill in this poll as soon as you can, and ideally instantly. Where in the world are you joining from? As soon as you have done that, there will be a new poll which addresses what sector you represent. Now here is the result, and we can see that the majority is from Europe, but we also have participants from Asia, Australia. I lacked Africa, but maybe colleagues from Africa will join later. Let's have a look at the next poll. So which option best describe your sector? Please fill in this now. This webinar will consist of a keynote and of 3 panels, and we have a great team of presenters, and I will introduce them along the way. Now, if we can have the results of the second poll. So we see that the participants are the dominant constituency is research or academic, but we have students also, we have policymakers, we have a few from private sector and multilateral. That's excellent. Without further ado, let me introduce the keynote speaker, who is Sir Andy Haynes, who is a professor of environmental change and public health at London School of Hygiene and Tropical Medicine, where he before was director for a decade. He's been doing pioneering work in this area. He was the chair of the Lancet Commission on Planetary Health. He is a member of 2 commissions, one on pollution and another one on COVID-19. Now he's on well-deserved vacation in Spain. So this presentation is pre-recorded. And I now would like Anna to start the keynote presentation. So in a way, virtually over to you, Andy.
Well, thank you very much for inviting me to talk. What I'm going to try to do is to link climate change and other planetary health changes with human health and suggest how intersectoral action can help to reduce the dangers of climate change and also support healthy and resilient approaches to safeguarding human health. In brief, a lot of these ideas were outlined in the commission that I chaired some years ago, the Commission on Planetary Health. And if you're interested, you can download that report from the Lancet website. We summarize planetary health as the health of human civilization and the state of natural systems on which our health ultimately depends. And as you can see, we're now in a totally new geological epoch. Humanity grew up really in the Holocene epoch, when as a species we evolved from being hunter-gatherers to agriculturalists, and latterly to urban dwellers. And about the middle of the last century, it became apparent that humanity was the driving force that was altering the global environment. And recent years have shown us how these changes, these trends have escalated and how they now threaten to undermine the resilience of natural systems on which our health ultimately depends. The slide summarizes the socio-economic trends, which I won't go into detail about, but you can see there's been dramatic increase in economic activity. Human health has improved, more than 20 years life expectancy increase since the middle of the last century. But all of those improvements in human health, which have been highly, of course, highly inequitable, have been accompanied by costs, and those costs have been borne by Earth systems. And the right side of this slide just shows you some of those Earth system changes, like the accumulation of carbon dioxide, which is the long-acting greenhouse gas, other short-lived climate pollutants like methane, changes in surface temperature. We're up to over 1.1 degrees centigrade global average temperature increase since really human activities began, and many other changes, including a dramatic loss of biodiversity, more than 100-fold greater than pre-human times. And all these changes have complex and often still understood, only partially understood impacts on human health. But we know enough to know that these will be overwhelmingly negative and that they could threaten to destabilize our society. This shows you the changes in surface temperatures since the temperature records began in 1880. And you can see that those temperature records all tell us the same things, and that is that temperature has increased. It's not uniform, so it's more in some parts of the world, like the Arctic, than others. And it's more over land than over the oceans, but there have been decisive changes in global temperature. And these have also been accompanied by changes in extreme events, such as increased rainfall events, droughts, wildfires in some parts of the world, and probably also very intense storms as well. So this multiplicity of changes can have big impacts on human health. And this slide just shows you how rising temperatures are increase risks to human health, both directly and indirectly. You can see that ecosystems are threatened. There could be large-scale singular events like melting ice sheets, coral reefs are dying off, our coastal regions are flooding, and there's also increased river floods. So the health effects are experienced and manifest through a range of different pathways. They can range from the very direct effects like heat-related morbidity and mortality to the less direct effects like changes in crop yield. And the economic sectors all contribute to these greenhouse gas emissions and to these other environmental changes. And you can see how the different sectors contribute to the greenhouse gas emissions. Electricity and heat production, about a quarter, agricultural, forestry, and other land use, a quarter. Recent estimates suggest even a bit more. Buildings, significant, about 6%. Transportation, 14%. Industry, 21%, and other, around 10%, something of that order. So multiple sectors contribute to climate change, and therefore the solutions to climate change will also have to address multiple sectors. This slide just reminds us of how climate change can affect human health through this multiplicity of pathways. It can affect, for example, extreme heat can cause reductions in labor productivity, can increase death rates around the world. Flooding can have pervasive effects on mental health, which can last for quite long periods. Changes in air pollution levels, for example, as increased wildfires, can also directly affect human health. And then changes in many infectious diseases, including vector-borne diseases, but also water and food-related diseases as well. And then probably indirect effects, which may well turn out to be the most important effects due to the damaging effects on socio-economic systems, pushing more people back into poverty as a result, for example, of declines in crop yield. So the World Bank has informed us that in the absence of effective action, 100 million people or more could be forced back into poverty by 2030. So you can see how climate change could affect health through these multiplicity of mechanisms. So moving on to what we need to do very quickly. So we need to do two things in terms of climate change, and indeed many other environmental changes as well. We need to adapt to that change that we cannot prevent, and that means having more resilient healthcare systems, more resilient energy systems, better flood protection, better storm early warning systems in some parts of the world, and so on. But we also need to mitigate, and when we talk about mitigation in climate change terms, we mean action to reduce the emissions that cause climate change. So moving towards clean renewable energy and so on, changing our food and agricultural systems to produce food at a much lower environmental impact than today. The importance of these mitigation actions is not only do they reduce the risks of climate and other environmental change, but they also bring near-term benefits. So the benefits from reducing climate change are obviously medium to long term. They will roll out over decades, centuries, and millennia to come. But the benefits of decarbonisation, for example, are in the near term, for example, due to reductions in air pollution, which can benefit our health in a very short time. So what can we do to mitigate? Well, we can tackle our transport systems, which are inefficient and polluting. They drive CO2 into the atmosphere. I've mentioned our food system. We eat too much of the wrong kind of food. Animal products, for example, particularly ruminant meat, obviously responsible for quite a lot of methane, which is a major greenhouse gas. So diets which are higher in fruit, vegetables, nuts and seeds, and particularly for high consuming populations, reduced amounts of red meat consumption can also benefit health and reduce environmental change. And obviously, if we decarbonize our energy system and take out fossil fuels from the energy system, replace it with clean renewables, then that will benefit our health in the near term. So there are big potential health co-benefits. In the energy system, about 7 million premature deaths a year from household and ambient air pollution. We believe from a recent estimate we've done about 3.6 million ambient air pollution deaths a year from fossil fuel burning. So if we stopped burning fossil fuels, we could, at least in theory, prevent those deaths from occurring. And those deaths are due to ischemic heart disease, from chronic obstructive pulmonary disease, and a range of other health outcomes. Transportation, we know that the transport system kills over 1 million people a year from road traffic crashes, and about 5 million premature deaths a year from physical inactivity. Much of that is due to the way in which we depend on the private car, in which we undertake relatively little active travel, which is probably the most practical way of getting the population to become physically more active. And then finally, food and land use, about 11 million premature deaths a year related to dietary risk factors, inadequate fruit and vegetable intakes, in too much red meat, and in some countries, of course, increasing ultra-processed food and refined carbohydrates as well. So potentially very big benefits from transforming our economy into a healthy, low carbon economy, but that will require intersectoral action. The geographical scope of that is exemplified in this slide. The top slide just shows you where the benefits would occur from decarbonizing the energy system, the fossil fuel, taking out fossil fuel burning. And you can see that there'll be big benefits in China, India, Europe, North America, less so in Africa and Latin America, so they burn less fossil fuels, but as they move along, if they do move along an economic trajectory which takes more burning of more fossil fuels to generate economic growth, and obviously those impacts will increase. If we take into account other human activities like household air pollution that seeps out into the ambient air, then there would be there are large numbers of deaths in Africa and elsewhere as well. So moving towards clean energy can benefit our health through reduced air pollution, as long as it's affordable for the poor, as long as it doesn't price the poor out. And currently, of course, we subsidize fossil fuels, we subsidize air pollution in many respects. And the IMF has told us that over $5.2 trillion in 2017, that's the equivalent value of those fossil fuel subsidies if we value the health impacts that they cause. So we need to price fossil fuels and other damaging emissions adequately in order to reduce emissions and make them less able to compete with renewable energy. Renewable energy costs are coming down, but because we subsidize fossil fuels in some parts of the world, they can still compete with renewable energy. We know that urban policies are going to be crucial because urban cities drive economic activity and they're responsible for a lot of global energy-related greenhouse gas emissions. And this slide compares Atlanta with Barcelona. You can see it's a similar population, about 5 million, but vastly different transport-related carbon emissions because Atlanta is a sprawling city and you have to use your private car to get around in Atlanta, whereas in Barcelona, you can use public transport and you can walk and cycle. So the way in which we design our cities and retrofit cities is going to be crucial both for climate change and health. And people are now talking about the 15-minute city, where all of our crucial resources that we need, our healthcare, schools, and shops are within a 15-minute walk or cycle. We know that co-benefits can accelerate climate action through city policies. A recent study has shown that those cities that cited co-benefits are more than twice as likely to take decisive mitigation actions as those cities that did not report co-benefits. So co-benefits can be a big motivator for climate action, and they can help to foster political support and the support of the public, particularly as we emerge from COVID. This shows you the benefits of healthy diets from the Lancet Commission. Possibly 10 to 11 million premature adult deaths a year could be saved if we were able to move towards a more sustainable food system. And the diet is summarized in this slide. You can see there's more fruit and vegetable consumption, about 500 grams a day, much less ruminant meat consumption, more whole grain carbohydrates, and so on. So big benefits, both to health and the environment, by consuming more healthier and lower environmental impact diets. Obviously, they need to be adjusted to meet different cultural requirements. And lastly, the healthcare sector itself. The healthcare sector, as we're now understanding, contributes about 5% to global greenhouse gas emissions. The National Health Service in England has committed to net zero, even for its indirect emissions, and those are summarized on this slide. These are the scope 3 emissions from business services, medicines, medical devices, waste and water and construction. And these constitute quite a large proportion of the emissions from the healthcare sector. So, so far the NHS in the UK has made quite big progress in terms of its direct emissions, but has got quite a long way to go in terms of indirect emissions. So this just again reinforces the need to interact with other sectors. So interacting with the pharmaceutical sector, the medical devices sector, to ensure that they decarbonize their supply chains in order to reduce the environmental footprint of the overall health system. And finally, we need then to move towards what we might call one planet living, the kind of living that a lifestyle that, if it was extrapolated to the whole population of the planet, would enable us to live within planetary boundaries. And that will require a radically reorganized economy, what some people have called a healthy and circular economy. In other words, more remanufacturing, recycling, reusing, sharing use, repairing, rather than greater consumption of primary materials, which is what we do at the moment. So how we implement that economy will obviously influence the kind of health impacts of it. So if we can recycle in safe ways, reduce exposure to toxic chemicals, then we can obviously create a much lower environmental impact and a healthy economy. So we need to identify key tipping points for rapid social change. We need to emphasize the opportunities and the benefits of change, catalyzing the uptake of policies, technologies, and interventions through a range of different sectors. We cannot do this through the health sector alone. And that, of course, will require integration of climate action for health with the Sustainable Development Goals. You can see that from this slide. You can see how health, of course, SDG 3 is specifically focused on health. But as we know, many of these other SDGs, poverty, zero hunger, education, gender equity, clean energy, sustainable cities, and protecting health from climate change are all, of course, absolutely essential for us to achieve health. So the message, I think, is in order to achieve universal preparedness for health, health in this broadest of contexts, engaging all these other sectors in society beyond the health sector itself, attending to broad working and living conditions of society, reducing the human destruction of nature and the loss of biodiversity. You can see that it's clearly an intersectoral challenge, and there is a need really for new governance mechanisms that would engage other sectors in this vital endeavor. It really relates to the global transformation to health, putting health at the center of the economy within these defined planetary boundaries, tackling the commercial, social, political, and environmental determinants of health in an integrated fashion. We need to integrate this with the traditional global health security and the universal health coverage agendas. And we can do that by ensuring that these policies both reduce the risks of dangerous environmental change, but also reduce the environmental footprint of society and the healthcare sector. And as you can see, preparedness has to be universal, multi-level and intersectoral, and will demand collaboration, working together, building on the SDG agenda. So in conclusion, the key messages are that global demographic and environmental trends have got long-lasting effects on global health, and those vulnerabilities that have been exacerbated by COVID-19 will certainly also be exacerbated by climate and other environmental changes. This interplay shows the need for solidarity within the global community to build cooperation, not just competition, and to build resilient systems, but also importantly, systems at a much lower environmental footprint. So clearly, we cannot go ahead with a business as usual approach. This is not going to work. And a non-business as usual approach is really needed, which aims for a healthy transition towards a zero carbon economy within planetary boundaries, and one which is also capable of being much more resilient and rebounding from the shocks which are bound to come in the future. Thank you very much.
Thank you to Andy for setting the scene. It's now my privilege to introduce the first two panelists. As I said, we will have three panels. And this first one is being introduced by Dr. Syama Kuruvilla, who is a Senior Strategic Advisor at WHO, Director of UN Secretary General Independent Accountability Panel, Every Woman, Every Child, and she was also co-chairing a research series on intersectoral approaches. She will use 5 minutes and talk on what does effective intersectoral action look like, non-business as usual. The other panelist is Dr. Jamila Mahmood, who is Special Advisor to the Prime Minister of Malaysia, and used to be the Undersecretary General of Red Cross and Crescent societies, and she will talk on protecting and improving human and planetary health insights from Malaysia. The word is yours, Syama, please.
Thank you, Göran. Thank you, Andy, and dear colleagues. In thinking through the question of business not as usual, or the incentives and leadership for multi-sectoral collaboration, I found it very helpful to think through the model that's presented in the background paper on the BMJ paper for this webinar. And this was empirically tested across 12 countries. But there are three main concepts to think through. One is about the situations that we all are in, about equilibrium, disequilibrium, and then a resolution or transformation. So I'll just start with the concept of equilibrium. And this relates to all the different components of our lives functioning as they're meant to, but functioning in an integrative way. So if we think about the situations we are in right now, the rooms you're in, the IT functioning, the furniture that we're using, the air, the environment, the buildings, the planet we live in, we're not having to think about the role of each sector in bringing all this together. It's just important they're functioning as they could, so that as they should, so that we can all participate meaningfully in a functional way in this webinar. And that's equilibrium. It's not that all the sectors need to be actively collaborating in every situation. That would be very inefficient. So lives go on with a certain amount of equilibrium, but they can get disrupted. And equilibrium gets disrupted for a range of reasons. For example, as Andy just noted, as a result of climate change, on socio-economic trends, on Earth's trends, or new technologies that allow us to do things differently, or data showing adverse effects on health, or in fact, a global pandemic like the one we are in right now. Over here, then, leadership and incentives, but also disincentives, are about the commitment of people to respond to that disequilibrium. And these discussions and dialogue about how do we transform situations and get to a better place. And the third element, therefore, is about how do we resolve or transform situations. So we start with equilibrium, where all the sectors are doing what they are meant to and functioning well. The disequilibrium and how the dialogue happens about what is happening and what solutions are available. And the third is the resolution or transformation. And here we find that really a science approach, not just in the scientific biomedical sphere, but also applied to our socio-political challenges, are really required. So as Andy said, we can resolve a situation through adaptation and building resilience to things we cannot change. But also, before we talk about mitigation and transformation, people sometimes make minor changes, or there are incentives not to change, say in fossil fuels or in users of different industries. And people somehow fight to keep the status quo and get used to that. Or you can have transformation, business not as usual, and achieve this one planet living that Andy talked about. So if we use a scientific approach, what does that mean? Well, we have to define a problem in a way that allows intersectoral action. So one of the examples used in the paper that I referred to was in South Africa, where there were rising rates of HIV among young adolescent girls and women. And if the problem were defined biomedically about viral loads or sexual and reproductive health, there would be a certain set of actors involved. But in South Africa, they decided to frame the problem as empowering women and young girls to make informed decisions, to transform their societies, which meant a different set of sectors got involved. And the same type of thinking about how solutions are designed with different sectors, but also how different actors then implement those and evaluate those. And here also it's important to see that definitions and measures of success change and vary across sectors, but also across different stakeholders, for people themselves and their experiences versus technical experts. And so it's here I feel that in looking at a new approach as to when intersectoral collaboration is needed and how, and who convenes, that we need transformation. So governments need to convene and coordinate, but also leadership from each element of society to bring this together as a holistic, transformative effort. And I look forward to the discussion with the colleagues on this call to see how we can really make this happen. And I just want to end with one point to say it's not going to be easy. The incentives are not structured in a way. Budget lines are by sector. They're not really the resources kept for coordination and joint up working. And there's not that approach to saying, how do we design solutions together as a society in ways that are understandable, meaningful, and actionable at all levels and for all people to achieve the world we want? I'll stop there and back to you, Göran.
Thank you so much, Yama. May I remind everybody to pose questions in the Q&A or reflections, comments, whatever, so that we have for the panel discussion. I now invite Yemila to make her presentation. Yemila, the word is yours.
Thank you very much. And it's a great pleasure and honor to be here today. Allow me to share some of the actions that have been done in Malaysia and maybe some of their thinking for the future as well. I am currently in a government position, but I also wear many other hats. So I will bring all these different hats together to demonstrate the intersectoral nature of how we need to tackle these problems that we're faced with today. Now, intersectoral action in health in Malaysia is not new. The intersectoral plan dates 1988, goes back to 1988, but this was primarily driven by mosquito-borne diseases, and particularly around malaria in plantation settings. And of course, this has evolved into other issues around dengue, for example, other vector-borne diseases in urban settings. But I think COVID-19 has been this real wake-up call for the country, and a real opportunity to introduce the importance of planetary health, and at a very personal level, and in my role in government now, as well as being a member of both the Economic Action Council and the Climate Change Action Council in Malaysia, it has been a tremendous opportunity to bring the dialogue not just around health, but also where it intersects with economy as well as climate change and other factors. To give you one example, the vaccination rollout that is ongoing in Malaysia is now being done with a green plan, a green vaccination plan, which means it is an opportunity to advocate for planetary health, to talk about why we have arrived at this pandemic and the many other viruses just waiting to be unleashed into a pandemic if we don't take care. But also to allow for a vaccination program that has a reduced carbon footprint as well as carbon offsetting. I believe it's one of the few countries, if any other countries doing it, I'd be very keen to learn that we have embarked on this. And this has been driven primarily by a collaborative approach to a vaccination program and bringing in the Ministry of Environment. And leadership is very key. We are very fortunate that we have a Secretary General in the Ministry of Environment that is very switched on, that believes in planetary health. As a result now of that, now we are developing a planetary health policy for the country that will be presented to the cabinet and later to the parliament for endorsement. So these are some of the real actions that are going on. Now, moving forward, planetary health is still, not so well known. Malaysia, of course, we know it as One Health and all the other iterations it has, evolved from. But one of the areas I feel that will drive us is also how industry adopts policies that are climate and planet healthy. And to that effect, the Central Bank of Malaysia has developed a very strict criteria around ESG, environment sustainability and good governance, but also has a joint CCC, Joint Climate Change Council, that is going to look at how is financing made available to companies and corporations, and they must be demonstrating a commitment to environment. And we are now adding in now slowly an influence on planetary health. Finally, I will say that as at a personal level, it's a huge champion of planetary health. So I'm so thrilled to be here with Sir Andrew. I will be heading a brand new planetary health center that we will establish in the summer, because this will be in an academic institution, but working across sectors. And the aim is that, you need to get this into young people's agenda, onto young people's agenda. Only then will real change happen, when the public and the citizens demand of us a better protection of our planet. Thank you very much.
Thank you so much, Jamila, for this, and also for emphasizing the role of the young generation for change. Thank you to both of you for your insights. We would like now to know from all participants, and if Anna kindly could put up the third poll, and you fill that in. It's a poll in relation to leadership. So once you have filled this in, please also make use of time to put your questions, your comments in the Q&A function. Let's hold it for a few seconds. Oh, I hear that there is a real planetary problem here. Unfortunately, Solakshana, there is a storm where she is, and her internet is thus unstable. Let's see how this plays out. Okay, Anna, do you have the results of this poll? So where do you think leadership lies in successful intersectoral action? Well, very dominantly with the national governments. Yeah, let's keep this for a few seconds more because it would be good for Shyama and Yemila to comment this in the panel discussion that will follow. So I'm not going to repeat what is there, but I will start with this first question. And we'll start with Shyama and then Yemila on how do you interpret and reflect on the poll results that you just saw. Shyama, please.
Thanks, Göran. I think the government does play a very important role because people elect them to actually join the dots and bring things together so that people can live and have fulfilled lives in a way that benefits individuals, societies, and groups, and also the planet. But within that overall context, I think all the other groups have a leadership role as well. People to give the feedback and take action in their own lives, of industry, of different sectors. And I think unless it all comes together with leadership across all levels, the government alone is not going to be able to achieve that type of transformative change or achieve that critical mass of action that's needed.
Thank you so much. Yemila, please.
Yeah, I'm not surprised that the poll showed that government is probably the most important because it really does require clear policies and a signal of commitment from governments to not only pay attention to this, but also to invest. I think that it does require us a lot of investment in terms of aligning, for example, how governments function if we are going to achieve the results, but also what you divest and invest in. So these are very critical issues that only clear government policies can drive. Having said that, governments are also, and politicians are also very much motivated by the votes that they get. So I do feel that communities and citizens have an extremely important role, and the power of social media and advocacy now can really change how governments look at critical policies.
Thank you so much. The first question that we have received is, while intersectoral approaches might be context specific, which are the main barriers, kind of generalizable barriers, generic barriers to implementing that approach? And we'll start with Shyama, please.
Thank you, Göran, and very interesting question. In the multi-country series that we studied collaboration across sectors, there were 2 or 3 generalizable challenges. One was, and Jamila referred to this as well, how governments, how societies are organized and the incentives. So the economic trends and so on are done by sectors. And the challenge of having meaningful intersectoral dialogues that involve different elements of society, from government to communities and individuals, there is very little investment in the process of intersectoral collaboration. That's one real challenge, and that requires different ways of working. The second real challenge is about how to actually have dialogues that as I mentioned in my remarks earlier, to help people understand, get on the same page on defining problems, on what are measures of success. And, each group tends to look at it from their lens and have different indicators of success and so on. And this might require rethinking as well. So it's both the investment and the understanding, which then lead to new ways of working. Over to you, Göran.
Thank you so much. Jamila, you want to comment, reflect, please?
No, I think I completely agree with Shama. I think that, prioritization is always difficult when there are so many competing priorities. And sitting in government now, I am now fully exposed to what I used to maybe raise my voice against, right? So you get a real reality check on that. But, then again, I still think, we need to use the opportunity that is afforded to us with this pandemic, to really rethink, what those priorities are. And then, I think that's how you get over, some of these challenges.
Thank you so much. The next question is about the relationship between One Health approaches and approaches to mitigate and adapt to climate change. Very interesting and quite complicated issue. Who wants to start? Shall we do the same order? Shyama, you want to go first here?
Sure. And to mention that right now, this week, is the World Health Assembly, where all countries are discussing the pandemic, trying to understand its root causes, but also the responses in different countries and a way forward through the pandemic. So these discussions are going on now. And I think there's, as Jamila responded to earlier, there is this moment where the realization of how interconnected we are across the planet, whether it's as individuals, as across countries, but also in the biosphere and the planet as a whole, and how any disruption or disequilibrium can affect us all. And I don't know that there are clear answers through, but I think it's an excellent beginning for the dialogue, and I hope we can all come together to move forward in a transformative way.
Thank you, Shyama. Jamila, please.
Yeah, let me start by saying that when I read and participated and listened to the independent panel's report, it was a really well-written report with very thorough analysis. But it told us all the problems and things that are no surprise to us who've been managing and working in pandemics. What was lacking is any notion of what compliance looks like. Where's the accountability? And I think we've got to move forward now into looking at this. I know that there have been deliberations on the treaty, which aren't going, I don't know how that will end, but there are real issues around, accountability and compliance that we must tackle. And I think this has to be put on the table. Now, where should this be led from? Is it from the global perspective down to regional and local, or does it go the other way around? So I think these are questions even I myself am asking each day. But certainly, that dialogue and that discussion must be on the table. The second thing, of course, is that, whatever you call it, whether you call it One Health or Planetary Health, One Health was basically human health, animal health. But we must also recognize the intersectional nature of the challenges that we're facing. The complexities that we're facing are not linear at all. And, as we speak, India is facing a COVID crisis, but it's also facing cyclones and, all the other, challenges on top of already underlying challenges. So until and unless we're able to redesign that future to take into consideration these, competing and I would say colliding threats that we are faced with today, and I think that's where the whole planetary health concept is a very universal and very broad concept.
Thank you so much for this. I think we have time for one more question, and I'll pick the one that is also a question I think that fits very well with the third panel, where all of the speakers will be participating. The question is, which are the top 3 priorities in moving forward with the planetary health agenda? So any of the 2 of you that wants to have a go with that one? The top 3 priorities moving forward with the planetary health agenda. I think we should also revisit this question during panel 3, but let me check. Maybe you can raise a hand if you want to comment. You want to? You're nodding. Jamila, is that you want to go ahead?
I think first of all, let's create awareness. I think that's number one. The basic awareness that this pandemic didn't emerge out of nowhere. It has come as a result of, us violating planetary health boundaries. And while, it may look like a massive issue, but as presented by the keynote speaker, even at an individual level, if we alter our own behaviors, then things will start to move. Like it's like ripples in the ocean. You've got to create that in that individual level thing as well. The second thing, I think, where are the incentives and disincentives for us not to protect planetary health? I think that has to be made clear. And where does industry that is driving the carbon industry, the fossil fuel industry, how do we ensure that we create incentives and disincentives as well? And then finally, you asked for 3, so I'm going to stick to 3. The third thing is, it is about, I was reading the Human Development Report, and it's very encouraging to see that planetary health is emerging in the report now. So it's about quality of life, right? And it's about, asking ourselves, that moral question of, what we are doing for that next generation. I think you've got to go back to ethics and morality. It's very important. So I think it has to be driven not just by health experts, but everyone, right? Whether it's industry, whether it's politicians, whether it's religious leaders, but this is about saving humanity.
Thank you so much for this. There is one more question, but and I will present it to you, Shyama, because it's directed to you. But I ask you kindly to keep your answer to the final panel. And the question is such: defining a problem, as you mentioned, being a very important part of getting started, because we want concrete actions here. Huh? It's not only NATO, no action talk only, if you want to do what is needed for mankind and for the planet, by the way. Is defining a problem your way, is that the same as the mission approach that Mariana Mazzucato increasingly talks about when it comes to change management? Let's keep that for the final panel, if you accept, Shyama. And then on behalf of everybody, thank you so much to the 2 panelists for your insight. We move to the second panel. And it's my sincere hope. I wonder, Anna, if you can check this in one way or the other, if Sulakshana Nandi, if she has internet in spite of the storm. Oh, she is here. Wonderful. So you beat the climate challenge, Sulakshana. Wonderful. She is the national joint convener of People's Health Movement in India, and also the co-chair of Public Health Movement Global. In fact, my mentor was part of the inauguration of this great organization. And her focus is on health equity and vulnerable populations. She will talk on people power. We have already addressed that as an absolutely essential change agent. And that being at the heart of intersectoral action to secure the future health of people and the planet. The second panelist is Professor Ole Petter Ottersen, who's a neuroscientist. He's the president of Karolinska Institutet, Sweden. And he is, since several years, a very strong advocate for global transformation for health. And his interest in global health, I think, came out of him chairing the Lancet Commission Global Governance for Health, which is very interesting reading, and I recommend it to everybody. It also adds on not only commercial, but also the political determinants of health. Now, he's also currently a board member of African Population and Health Research Center, which is situated in Nairobi. And he will talk of intersectoral action, generating momentum for change with universal preparedness for health to secure future of people and planet. We'll start with Solakshana. Word is yours, please.
Yeah, thank you, Göran. So I will, I think, to start with, I want to emphasize that, what we are talking about intersectoral for us, but for the people whom we are talking about, and for communities for whom we are thinking of in terms of programs and actions, it is in fact their whole lives. So, there are no silos in living, right? So, whether it's health, education, nutrition, it all is affected, and their survival really depends on, a total of their circumstances, of which class they belong to, which caste, which gender, what they're able to eat, how they're able to access healthcare, the resources that they own. So it's very important, to recognize who is being affected the most through all these changes, and recognize any talk on intersectoral action needs to recognize the layers and levels of actions and interventions that are required. So I will share a couple of experiences. The first is around the work that I've been involved in my state, Chhattisgarh in India, with community health workers, or the Mitanins, who have really, their work has been on their lived realities, and they have not compartmentalized their work in terms of health services work and work on social determinants. So in 2006, when the state-owned Forest Development Corporation started felling nearly 40,000 hectares of forests, dense forests, and involving around 20 million trees, they resisted, they went and stopped the felling, and the struggle went on for many months. There was also a legal battle, but finally they won, and the corporation had to exit that area. This was so when people would ask the community health workers, you are health workers, why are you working on forests or on food? Because they were very clear, forests affect their livelihoods, it affects their food security, it affects the, it's intrinsically related to their culture, their religion, and this is all again related to health. So they found it completely acceptable and rational to work on these issues. Subsequently, they also put up a struggle against the extraction of coal bed methane, which is a clean fuel for cities, but it would have really meant, destruction of their rivers and forests, and basically of their lives and livelihoods. So that was another struggle that they did. The second thing I want to talk about, when we talk about climate crisis, and there is in the global north a lot of emphasis on vegetarianism, and but in a place like India, we have campaigns and children in India who are really struggling and demanding eggs that have been denied to them due to really ideological and religious ideas of the ruling party. So that again in Chhattisgarh, we've had movements for the right to health and the right to food campaign have come together in the Give Eggs campaign. It's called the Anda Do campaign, in a state where nearly more than 1/3 are of indigenous population with very high malnutrition levels. 82% are non-vegetarian, but the previous right-wing government has been consistently denying the children eggs in the school meals and in the government nutrition program, and taking a pro-vegetarianism stand. So this was again another struggle that the movements came together to fight on, and I mean, from the local communities, from the self-governing bodies, the panchayats, to the children, to various Adivasi leaders, advocated with the government, and only with change of government did this policy of giving eggs really came to our state. So the third thing that I want to highlight is, we have been talking about environmental devastation, but, for people that we work with, it's a constant struggle. It's a struggle for survival. It's a struggle against the onslaught of people's ownership for resources. And, this devastation that we see, it affects, the people who are more vulnerable. It's really a manifestation of the power, how it is distributed, in society. And any work on future health and intersectoral action and on against the climate crisis needs to recognize, acknowledge, and name and shame the kind of capitalist structures that produce this kind of distress, for people. And as the People's Health Movement, we do try to do that, and we do recognize the social determinants of health and how they're intrinsically related to each other. And I would want to share, we have thematic circles in which, groups sit and discuss about the various, aspects. So we have 6 thematic circles: the gender, justice and health, environment and nutrition and food sovereignty, trade and health, equitable health systems, and war and occupation and forced migration. So we do recognize that health incorporates all these aspects, and from struggles that are very local in various countries and regions, we also undertake political economy analysis, try to publish some of these thoughts, and build capacities of younger activists to understand health, in this broader perspective, and also build solidarities with organizations. Because, finally, what we also see that, there is corporate capture of governance at all levels, and at all levels, from the country to the global level. There is the processes are legitimizing the role of corporates and their cronies in decision making. So we need to demand accountability of multilateral organizations, and we need to question the infiltration of private interests. And this all greatly affects the way health is, defined, and action on, intersectoral action on health is planned. So just to end with some of the lessons that or the takeaways from these struggles. See, the first is obviously that, people's organizations matter, people coming together, united matter, and people's struggles and campaigns matter. But it's also important that the owners should not be on the victims or the survivors to bring about change. It is the perpetrators and the enablers that need to take responsibility or need to be forced to take responsibility of what's happening. Secondly, when we talk about programmatically or organizationally, we need to recognize the importance of the social determinants of health and the structural drivers of inequity, and use that narrative and translate that into action. Unless you start articulating it, it will never then translate into action in your organizations or in your programs. The third, I would say, would be, the importance of the structures for accountability. And in that, the political space that activists have or people have, whether you have a democratic government, whether you have an authoritarian government, that really matters. And, and also the legal frameworks and what rights are codified in your countries. I mean, those all matter in our struggle and in the, the action in the intersectoral action, because I mean, we have seen a lot of violence on activists and on people, on indigenous communities who are demanding ownership of their resources. I mean, it's like a daily thing that we see all over the world. And most importantly, the lesson learned, just the last thing, is that, publicly owned services, institutions are more amenable to accountability. Where there is a profit motive, and especially when then the state colludes, it's very difficult to get accountability and act on it. And like I said, the struggles then get intensified. There are crackdowns on civil rights, human rights defenders, and violence and deaths of indigenous people trying to protect their resources. So just to end, I mean, it is the responsibility finally of the government. And as I've said that, publicly owned institutions and services go a long way in trying to ensure and assure that kind of action and protection. Yeah.
Thank you so much, Sulakshana. We are slightly behind schedule, but that's not a problem. I will solve that. And I really want to listen to Ole Petter now, and so that he can use his 5 minutes. Over to you, Ole Petter.
Yes, and I think I will start with Sulakshana, and thank you, Sulakshana, for your intervention. Action, that is really what is needed now. I must say I'm impatient after having attended sessions like this over so many years. We are pretty sophisticated when it comes to how we frame the challenges that face us in this world. But we are not as sophisticated, I dare say, when it comes to action. And this is something I would like to dwell on in my short intervention. So the point is, as I see, that accountability, responsibility is a key element in this discussion, and several of you have mentioned this already. Where lies the responsibility and accountability? The funny thing, when you go to what we all are looking for as a sort of document for motivation, UN's Agenda 2030, the term we, the responsible we, is used more than 100 times throughout this document without defining who are we who are responsible. So the accountability issue, the responsibility issue is certainly very, very important. And I will get back to it. The second very, very important issue, I think, is from where shall we derive, from where shall we get the momentum, the leverage, the energy, the impetus to change for a better health and a better planetary health. And I think the key now is obvious, I think. We have to do what we can to derive energy from the crisis that we are still in the midst of, the pandemic. Never waste a crisis is a common term. The crisis is a tragedy, obviously, but I think we should use the COVID-19 pandemic as a source for the energy and impetus and momentum we need to change the world that we live in today for a better health and also planetary health. How do we do this? Andy was so kind as to introduce the term universal preparedness for health, which we have tried together with Göran to launch as a term that can afford, that can give us the sort of leverage and energy that we need. What is universal preparedness for health? Well, as you all understand, it has to do with preparedness that extends across geographical boundaries, of course, but also across generations. So it picks up the sustainability issue, that we have a responsibility also for future generations. But not only this, embedded in the word universal also lies this multi-level governance aspect. We have simply to recruit energy from all levels of governance, not only nation states, but from local governance levels and the supranational governance level. So that's why we would like to use this concept, universal preparedness for health, as a driver, as an overriding concept for what needs to be done. But now to go to the more concrete issue. Everybody here talks about intersectoral action, that we need to communicate and collaborate across sectors. And this is exactly what also was the message in the Lancet commission that I was heading and that Göran referred to. By the way, it's a pity then that only 3% of those who attend this meeting, according to the poll, come from the private sector, because that's also a very important sector to recruit. So my question is very concrete. I'm impatient. Where should we find the forum for this intersectoral collaboration? Well, in our Lancet report, we came out with a sort of idea of preparing or establishing a multi-sectoral stakeholder panel that could be coupled to the WHO or to the UN system. Of course, that's an attractive way to promote multi-sectoral discussion. But if you think about it, we already have a forum for intersectoral collaboration, and that's the life science sector. Life science is something that every country strives for, not least Sweden, where I'm now. High ambitions for life science. Already in the life science sector, you have the public sector, you have the private sector industry, you have the healthcare sector, and you have academia. And yesterday, in fact, just by coincidence, we had a 5-hour-long meeting where all these stakeholders met to see what can we do together to come up with concrete action. And in fact, some very good ideas surfaced. The interesting thing is that also with the life science sector, you already have the funding bodies. So I would suggest that we focus on existing fora for discussing this further. And one such forum is in fact the life science sector. So coming back to planetary health versus health of people, that's in the heading here. Everybody, of course, would like to go for planetary health, but we have to be a bit opportunistic. We have to realize that no nation state has a responsibility for planetary health, but every nation state since 1648 has a responsibility for the health of its people. May I suggest that we put the people's health center stage and let planetary health be secondary, but still a consequence, of course, of building people health. I'm sorry, perhaps I'm too pessimistic, but the concept planetary health, even though it's very attractive and should be something we should strive for, it does not provide the momentum that is needed for the nation states to really focus on this challenge for the future. I think people's health, universal preparedness for health, should be key. That's my feeling, and that's, I think, what is needed to go for more concrete actions.
Thank you so much, Sulakshana and Ole Petter, for challenging us, for clarifying that the rhetorics may be interesting for academics, but what is needed now is an action plan. We now would love to hear from the participants. So kindly, Anna, put up pool 4, which is focusing on accountability. And while we are processing this, also put in questions or comments in the Q&A, please, so that we can have a efficient panel discussion. I'll hold here for a few seconds. Let's have the results, Anna. It's not only Ole Petter that is impatient, as you may notice. I'm also an impatient person, but hopefully benevolent. And I'm also very anxious for us to be able to have the 2 panel discussions. And we don't have that many minutes left. So can we have the results, Anna? Okay, this is about ensuring accountability. So what we can see here is a clear framework to which all stakeholders agree, which is a major challenge, obviously, and then transparency around activity and public reporting, and all of the above. That's the three main results. So we'll do the same with this panel as with the other, and let both Sulochana and Ole Petter comment if you have any additional comments. And Ole Petter, you can start. Do you have any comments to the poll result?
Yes, I think that I would like to perhaps phrase it in a different way, although it relates to the question. What I fear, what I feel, is that much of what we're discussing is beyond the reach of what is, let's say, concrete action of today. We are discussing problems, challenges that are so overwhelming and at such a high abstraction level that we don't really know how to reach these goals. I think what I would put up front is not what is on the list here. I would say that the most important thing, in fact, is to come up with templates, with models for how to start working on these challenges. For instance, now we are discussing also in the World Trade Organization how to ensure, in the name of preparedness for health, how should we ensure that vaccines are reaching all parts of the world, not only the Western world? It's a tremendous challenge. But why don't we come up with a sort of template? Why don't we say, okay, we need production facilities for vaccines also in low and middle income countries? Why don't we pick one? Simply to see what is needed to ensure that a nascent production facility, for example, in Africa, could be further developed to be a full functioning vaccine production facility. I think we need templates, we need models, and we need to start somewhere, because when we discuss this at the overriding level that we're discussing now, the challenges for most people are simply too overwhelming.
Thank you, Ole Petter. I think you can continue with one more question, and then I'll give the word to Sulochana, and this is for efficiency. So there is a question on the commercial determinants of health and the large corporations for food, alcohol, etc., being part of the problem rather than the solution, with increasing power, etc. This was one of the major take-home messages from your commission, by the way, that now everybody has access to. Do you want to make a short comment on this, how to deal with this? I think you're muted.
Are you asking me?
Yeah.
Okay. Commercial determinants for health. Yes, in our commission, it was an eye-opener to me, I must say. I'm just a neuroscientist, as you said. So it was a shock to me to look at the power imbalance in the world when it comes to health. And when it comes to certain tobacco companies, for example, they have more revenues than the GDP of many nation states. So there is a power imbalance in the world that we have to address. One example that is urgently needed when it comes to increased attention is trade agreements and investment treaties. Many of these trade agreements and investment treaties, they're made behind closed doors. They're not transparent at all. And many of these have obviously very, very strong negative impacts on health. So we should call for a system where such treaties are analyzed with regard to their possible health effects upfront before they are signed. And I think the world must be ready to promote changes that enable us to do exactly this. To know what are the health impacts before investment treaties and trade agreements are fleshed out. There is a development in this direction, but it does not go fast enough.
Thank you, Ole Petter. So Lakshana, you want to make a brief comment before we move into the final panel?
Yeah, just about the question that was asked of the participants. I think both of them were very mature, I think, responses considering our work and what we have seen. So one, I mean, I'd already started talking about the kind of frameworks that are needed to get this done, and rights need to be codified. There needs to be legal frameworks, laws for grievance redressal, mechanisms and penalties and things like that to enable that. And the second issue about transparency that has emerged, that again has been a huge problem, especially with regards to anything related to the private sector. So, I mean, here, globally governments are going into digital health and digitizing everything, but when you actually ask for that data, that's not available. So so transparency is a huge problem, and we have experiences in India where there have been laws demanding transparency that have been used very effectively by social movements and campaign to understand exactly what is going on. So just to give my vote on that, on the transparency issue. Yeah, I mean, I think frameworks, including things like the binding treaty on human rights and business, and I mean, a lot of these things are being fought and not allowed to be passed or be approved or be signed on. So I think, yeah, so that's my comment on the previous question.
Thank you so much, both of you, for your insights. I'd now like to move into the final panel, where all 4 panelists will participate. And I'll ask you kindly to try to be as action-oriented as possible. This panel is supposed to address the when issue. I mean, we talked about the future health. We haven't talked so much about the timelines as you see them. We've talked about accountability. We haven't talked so much about mechanisms. A little bit, and Ole Petter probably the one that was most concrete. But all of you could kindly think of and reflect on and present the way you see existing fora for measurement and accountability that could be used for this. And finally, if you, in a sentence, a few words, could boil down this whole challenge into what you think is absolutely most important for health of people and the planet, that would be excellent. Now, I'd like to start, and we go in that order. Shama, Yemila, Lakshana, and Ole Petter. We start with you, Shama.
Thank you, Göran. If I could just reflect on the discussion through the webinar. Accountability has come up a few times, and I just wanted to update that in relation to the point Ole raised on universal preparedness and accountability. Certainly the accountability mechanisms in place haven't worked so well. And so there is a new mechanism being set up called the Universal Health and Preparedness Review, which is supposed to be a council of member states themselves, governments who are holding each other accountable and able to review progress. And this is a WHO-led process, but it would also have implications for at the level of the heads of government. Keeping on with that in terms of actions, one of the questions, if I can refer back to the question you had raised earlier, Göran, on Mariana Mazzucato and the moonshot economy approach. Certainly she talks, and also to say that she's now heading a WHO Council on the Economics of Health for All. And the idea there is about identifying these big scale ambitions that all of society, different sectors can be mobilized to address. but I just want to come back to the idea of structuring problems. And there are lots of tools and scientific approaches to do that in a way that's inclusive and interactive. And it has to be that way, going back to what Jamila said as well, because it's people who drive either demand for private sector products or also demand priorities from governments. And I was recently involved in a project that was looking at providing guidance to the public, which has not been done very well, as we know, through the pandemic. And health literacy experts saying that it has to be provided at a level that is at a fifth school grade level readability, which is actually very, very simple. So some of the very complex issues and concepts we're talking about here might not translate. And finally, I just want to say that there are several mechanisms, and I mentioned some of them now. They need to be strengthened. They need to be made meaningful. And perhaps we start now in terms of the when, Göran, but adding a layer of accountability and adding a criteria that whatever solutions are made, we look that together, is this the one that can benefit people the most, that can benefit societies the most, both current and future, and that can benefit our planet as a whole? If we have those three criteria and get people's inputs on this, we can start now with the mechanisms we have, but change the way we work so that it's not business as usual. Over to you.
Thank you so much, and sorry for not being clear enough. I ask everybody in the panel to use not more than 1.5 minutes, because we will end sharp on time. Jamila, please. Are you with us, Jamila? If not, Sulakshana, would you like to go? And try to make it within less than 2 minutes, please.
Sure. So I think when you talk about timelines, I think it just needs to be now, because, people are dying and due to lack of this kind of action. Last week, there were 3 people were shot in my state, 3 from indigenous communities were shot in my state protesting against takeover of the natural resources and of setting up of military camps. So it's really urgent. I mean, it's and in terms of what we can what we need to do in terms of going forward, PHM has always believed that only a new economic and I would add a social order would really should be what we aim for. And if I can just sort of illustrate that out, also talk about some things that we ourselves can do. So I think academics, global health experts, must acknowledge the and study the role of structural drivers of ill health and do it within a political economy of health framework. Not only a notional one, but actually be critical. Not just use the words, but actually do it. And also putting people at the core of questioning and inquiring. So, and just ask what people really need. And I think people in global health and research and policy need to also take steps to stop colluding with the corporate and the private sector. And as movements and organizations, we really need to build solidarities across sector. So yeah, I would just say that.
Thank you so much, Sulakshana. Let me check if Jamila is back again. If not, Ole Petter, please.
Well, I think we should rephrase the question, because we already have a timeline, haven't we, Göran?
Absolutely.
We have UN's Agenda 2030, which is, in my mind, a timeline for improvement. What we need is to have sort of metrics to sort of gauge how far we are moving towards the ambitions embedded in the UN Agenda 2030. During this pandemic, we have seen a discussion coming up whether the UN's agenda is realistic or not. And some people have called for a revision of this agenda. I feel that we should more than ever use this agenda as a goal, as an inspiration to really reduce the inequities in health. And in fact, if you think about it, health is the most obvious sort of, what should we say, common denominator of the 17 different goals. Using health as a sort of a concept for the Agenda 2030 would help us understand better what these goals are all about, and also perhaps help us reach them, if not in full.
Thank you so much. It's now my privilege to conclude, and I will do that very, very briefly. I think we have agreed that there are lots of different initiatives, different agreements. One of the questions that we didn't have time to respond to in any of the panels was a question on what about health in all policies? What about social determinants of health? We have talked about, and they have been linked to intersectoral approaches also. How do we best combine this for synergies and efficiency? This is a rhetorical question that we will use also in the report, and that we cannot answer now. Very, very clearly, we need action. And as Ole Petter said, we already have a time frame, 2030. And one other question we didn't have time to respond to was the question balancing people's health and planetary health. And Ole Petter promoted the focus with people's health in the center. But how does that relate to if the planetary boundaries are changed in the way they are being changed? Now, if we want action, we need measurements. And with measurements, we need to hold powers accountable. And it was mentioned that we should use the different systems already in place, including powerful systems, and life science is obviously such a one. What we did not manage to address is the power, what's going on, the changing geopolitics. So Lakshana clarified in an excellent way, you know, the asymmetries in power, and you know, the need for the importance of including vulnerable representatives from vulnerable communities in the decision making. We are not going to solve everything here. We have raised a lot of issues. We will try to come up with conclusions that are even more clear with this, but I would, in the remaining minute, like to thank all the presenters very much. Hope that Andy Haynes has a well-deserved vacation. I would like to thank all the participants for being active. We will do our best to summarize this webinar in a way that will be useful. I would finally like to thank the George Institute and the organizing committee. And especially would like to thank Anastasia Bau-Bertrand, Kent Buse. I want speedy recovery for him. I'm sure everybody is behind that. And also Marinke van der Meulen. And to all of you, dependent on where you are in the world, good night, good morning, have a good day, and let's stay in touch. We have a mission. We need passion, but we also need action. Let's see how we can contribute and how George Institute and the various organizations that we represent can contribute. Thank you so much. Bye-bye.